Enlarged prostate and glutathione, also known as benign prostatic hyperplasia. Sadly, many men secretly suffer from an enlarged prostate. Its medical name is benign prostatic hyperplasia hypertrophy. The prostate gland is the shape and size of a walnut. As you can see from the image on the left, the prostate gland is right under the bladder and wraps around the urethra. It is in between the pubic bone and the rectum. The prostate gland is an integral part of the male reproductive system. The prostate gland is responsible for producing the fluid that carries the sperm when ejaculating. In a man's life, the prostate has two big growth phases. The first one begins when a boy reaches puberty and his prostate gland doubles in size. The second begins around age 25. This second growth phase is what can eventually lead to an enlarged prostate later in life. Prostate enlargement is mostly found in men beginning around age 50. The majority of prostate enlargement cases do not lead to prostate cancer as it is not malignant. Even its medical name states benign prostatic hyperplasia. The major problem with prostate enlargement is a loss of quality of life, as its symptoms can include frequent need to urinate, waking up in the middle of the night needing to urinate, not being able to start urinating, urine remaining in bladder after urination, slow and weak urination, leaking and/or dribbling of urine once done urinating, urinary tract infection, blood and urine loss, of sexual interest. What happens is that when the prostate enlarges, a layer of tissue prevents it from expanding. This puts pressure on the urethra and causes the bladder wall and bladder muscles to thicken. The bladder is now hypersensitive to even a very small amount of urine, which contributes to frequent urination that now has to go through a more narrow urethra. As time goes on and nothing is done to help, the bladder can lose its ability to empty properly, and so urine will stay in the bladder. Although not malignant, if nothing is done, prostate enlargement can lead bladder stone, bladder or kidney damage, or incontinence. Please note that while many men may experience prostate enlargement, not all men experience any symptoms normally associated with an enlarged prostate. Glutathione deficiency is a contributing factor to having symptoms. Researchers have found that abnormal growth in the prostate gland tissues often corresponds to deficiencies in glutathione enzymes. Increasing your glutathione can improve urinary flow and functions by powerfully stimulating the reproductive and immune system. Glutathione is a powerful anti-inflammatory and will help shrink the prostate by reducing prostate tissue inflammation.